Great, everybody, it's 9 o'clock. I'm just gonna ask, there's about 5 people I haven't checked in. Could you just unmute and say hi if you're here? Madison Lee.
I'm here.
Thank you, Madison. Good morning. Michael Luchak.
I'm here as well.
Thanks, Michael. Kevin.
I'm here too.
Great. Katie McPherson.
I'm here.
Thank you. Kyla McCree.
I'm here too.
Great. Jerome.
I'm here.
George.
Here. Morning.
Good morning. Danielle Mitchell. Danielle, excuse me.
Yeah, I'm here.
Thank you. Kajal. Morning, Maggie. I'll be with you in 1 sec.
No worries.
Is Kajal here? Okay. Harshit.
I'm here.
Thank you. Nicole Smith. Yep, I see you're there. I didn't hear you, but I saw. Thanks. Natalie Schneider.
I'm here.
Thank you. Rebecca Watson.
Nicole Smith is here. Sorry.
Okay, good, Nicole. Rebecca Watson.
Yeah, I'm here.
Perfect. So the only person I don't have here is Kajal. No one's heard from her. I might have had an email in the last minute or two. Okay, I'm going to turn.
Professor, did you call my name too?
Who's that?
Tyler Hastings.
Yes, I've got you. Thank you. What I did was in the 10 minutes, I kind of checked who'd signed in, and then I was getting dizzy. So I thought I'd just ask the last 10 in person.
Okay.
Thank you for double checking. Okay, everybody. I'm excited, and I'm sure you're equally excited for this second day in the new world of studying online. We're excited to have Maggie Bergeron here, who's the co-founder of Embodia. And I'm just going to do a few minutes of housekeeping, and then I'll turn it over to her. So we've done attendance. I just wanted to do a little bit of an introduction, then we'll move on to Maggie's presentation. I'll stay online for 15 to 30 minutes if people had any questions. But at the end, because last week when we left you, the message was we're going to give you time to produce your pitch, and then you're going to share it. Well, now we're going to ask you to do it on your own and post it on Avenue. And then we will, next week when we meet again, have the opportunity to look at the best top 4 or 5. And then, of course, I'm inviting you to provide feedback on the session, and also that's where one person from your PBT group will cast your vote on the best pitch. In regards to the netiquette and other things, I just want you to remember to mute your mic, and everybody's doing that well. We're going to encourage you to use the chat feature, and I understand that that worked well yesterday in the REBP class. If there isn't a natural place to stop and have a chat, Maggie will monitor that. We'll also kind of create an opportunity. Just so, since we're not seeing body language, and we know how important that is in communication, we'll just create an opportunity for discussion. I wanted to pass on the message from the PT program that you're encouraged to use Microsoft Teams for group meetings and not Zoom. You may have some Zoom meetings this week, but wherever possible to move to Microsoft Team for like your PBT or REBP meetings. I also want to say a few words about self-evaluation. Right now, we're in the second week of the second action plan. And we want you to continue with this initiative for 5 plans in this unit. We're expecting some of your plans might change. For example, your 3rd action plan might be more related to the new way we're learning, like changing the way you prepare, or prepare for class, or using Zoom, or coping with less interaction in your studying and scholarly life. If we're still not virtual at midterms, if we still are virtual at midterms, we'll need to enlist Jill's help, and you'll connect with your faculty advisor in order to plan meetings in advance. But for now, just continue to finish your 2nd action plan and work on your 3rd starting next week. So now I'll call upon, before I do, I'll just remind you about the session outlines today, which are, we're going to talk about how examples of technology are integrated into physiotherapy practice, talk about entrepreneurship and innovation, discuss the responsible use of technology, being able to articulate what are the responsibilities under the CPO, the College Standard for Advertising. And you'll be doing a bit of self-directed learning for the last 2, which are identify the elements of an effective pitch and produce and communicate effectively using a pitch. So now I am going to stop sharing, and we'll ask Alina to come to introduce Maggie, and then Maggie will move on.
So it's my pleasure to introduce Maggie Bergeron. She is a registered physiotherapist from McMaster University. She's the co-founder of Embodia, which is a platform that helps improve the patient experience by allowing physiotherapists to share professional home programs with their patients, as well as it provides continuing educational courses for physiotherapists. She is the host of Health TO, which is an event that allows individuals who are interested in health technologies to come together and to collaborate, learn, and network with one another on a bi-monthly basis. She also has been invited to speak at universities, technology symposiums, and healthcare conferences across Canada. And finally, she is a mentor, placement host, and holds status-only appointment at the Department of Physical Therapy at the University of Toronto. So Ms. Bergeron, I'll welcome, and I'll hand over the floor to you.
Thanks so much. This is, that was a really nice introduction. It makes me realize I've been in the profession for 10 years. So yes, so please do use the chat. Thank you for the clapping. So maybe I do run webinars, and I've hosted events online before, and I think most certainly we're going to see more of this to come. So maybe let's just start so I can get to know you guys a little bit. So just in the chat, type out, let's go with where your last placement was. So where you were last in a clinical placement. Oh, Joe Brandt, I had a placement there when I was at McMaster. Juravinsky, they've been in the news. Awesome, St. Joe's, Brampton. Life Mark Aramosa. Yeah, so it's similar when I went to McMaster as well with the placements. So mixed. And so I'm just thinking here, this would have been your first clinical placement. Is that right, Pat? I know the program's changed since I was there and graduated in 2009.
They've just had their first 6-week placement.
Yeah. Okay, cool. Awesome. Thanks for sharing. So I will keep an eye on the chat as I go through my slides. Like Pat mentioned, it's a little bit more challenging not being able to see everybody. So just pop into the chat if you have a question or a comment by all means, and I will stop to address it. So I'm going to share my screen.
Maggie, I'm just going to jump in. The slides from Maggie's presentation are on Avenue to Learn, just so I know many of you like to put notes atop them.
Perfect. Sorry they were so late. As I'm sure everybody has been experiencing, it's been a busy time. And I feel very fortunate right now to have an online business, and this is maybe a discussion for another time, but about diversifying income streams and expanding on our skill sets as physiotherapists most certainly is, I'd say, a scary time for a lot of private practice clinicians. I do have a private practice in Toronto as well, and we've closed our doors. We are moving to an online option for appointments, but I'm sure, as you might be able to think, there's some limitations with that for physiotherapists. So, oh, I'm not sure why my image didn't show up. I put it, oh, picture can't be displayed. I put in a picture here that was circulating on Twitter last year, but I thought it was appropriate for today because it involves toilet paper, but it's really showing that design in healthcare has not, in terms of technology and in terms of our systems, has not been well thought out. The picture is really just of the toilet paper roll quite far away from the toilet. So what I'm going to go through today is my why I started Embodia. We'll talk about why healthcare is the last to adopt technology out of all the industries. Why is healthcare changing now? So what are the trends and drivers? And I'm just going to briefly touch on this lean canvas, which is helpful when you're thinking about how to make your pitch. So first, again, in the chat, just type in, what do patients really want? So when you see patients, public, private, home care, pediatric, geriatric, any population, what do they really want when they see a physiotherapist? Silence. What do you think? Someone to listen, feel better, ADLs, someone with knowledge, yes, solution for their pain, to be fixed, to get some help, someone to empower them, knowledge and compassion, absolutely. And the research is now really showing that what patients really want are those, what's traditionally called soft skills, but are being, say, rebranded to be called power skills: empathy and compassion, listening and empowerment. So this, to me, really sums it up: prompt, safe, affordable, effective, and caring. That's what they really want. And this hasn't really changed since we started as a profession 100 years ago. The idea that seeing the person as a whole rather than their disease, or often in the case of physiotherapists, their shoulder or their knee or their ankle. So when somebody walks into the clinic, you're looking at the whole picture, not just looking at, this person has an ACL tear, what's the protocol that I should be following? However, our landscape in healthcare is significantly changing, and we're already seeing drastic changes over the last week as well, with the increased pressure on our healthcare system. But regardless, even before the coronavirus outbreak, there's been significant changes happening. And some of that is just due to the fact that we're a different population. When our current healthcare system was formed, which was during the time of the World Wars, along with the physiotherapy profession, what we really needed was acute care and maternal care. But our population is very different now. We have an aging population that requires a lot of chronic care for their chronic conditions. And so we need to adapt as a profession and as a healthcare industry as a whole. And so, like it was mentioned, I did start Embodia, and to be honest, I started Embodia as a side project because I felt like I felt like the tools that we were using as physiotherapists were a bit outdated. You know, the stick figures, drawing out images for patients, sending emails to patients with Word documents, which is something that I used to do, or giving printouts was really an outdated method. So I teamed up with a chemical engineer, actually. So my business partner is a chemical engineer by training, but he was teaching himself how to code when we first started Embodia. And this was 5 years ago. And since then, we've added online continuing education for physiotherapists and rehabilitation professionals. And we have about 12,000 users on our platform who are either using Embodia for continuing education. We also host live webinars. We have a free one actually coming up this Friday with a panel where we will be discussing coronavirus and strategies for physiotherapists. You're all welcome to join if you'd like. We're going to host them every Friday with a different panel. But this coming Friday, it's Carolyn Van Dyken, Daryl Yardley, Nicole Sullivan, who owns a private practice in Toronto, and Debbie Patterson, and Urson Religioso, who's a physiotherapist in the US. So we're going to also get the US perspective. So in my journey from going from physiotherapist to health tech entrepreneur, I started to notice that the healthcare industry and the technology industries don't really talk. We don't really communicate. And so I started an event which was actually originally called Rehab TO, which was meant to bring together rehab professionals in the tech industry for a networking and learning event. That event was acquired by the Tech Toronto organization very early on when I was running it, and much to my relief, to be honest, because running events is a lot of work. So the Tech Toronto organization now works with me to host Health TO, and we bring together healthcare practitioners in the technology industry. Typically now we get about 400 attendees at each event. Our next one was meant to be April 2nd, but that is of course not happening. And I'm going to, so in this presentation, what I've done is I've taken some of the most popular topics that have been presented at TechTO Health. So I should mention Health TO has also been rebranded again to TechTO Health. And I looked at all of the presentations that have been given. There's 105 presentations in the past 4 years. And I categorized them into why healthcare is the last to change, the drivers, so what's creating the change now in our healthcare industry, and what are the trends? So the trends are things like telehealth, for example, or cannabis, medical marijuana, patient experience, VR, AR, those types of things. So I'm going to present those to you. And I've also, I've cross-referenced them to the major publications and research that exists. I am a Mac grad, so I still do look at the research. Okay, so again, using the chat, why do you think healthcare is the last to change? We generally live in a world that is tech first, or tech is an integrated part of every other business and industry. Why has healthcare not adopted so readily these changes? So what are some reasons that you can think of? You can go ahead and type any reasons. Tightly regulated, 100%. There's so much red tape. Change is risky, absolutely. We're caring for people's health, which is our most important commodity. So We don't want to take risks with that. Funding issues, yeah, where's the money coming from? There can be absolutely limitations with human interaction. So how do we meaningfully use technology? Yeah, so again, risk, mistakes, issues, tech can be dangerous. Yeah, expensive, money, absolutely. I'm gonna give you the top 4 reasons that were presented and that are very, very much talked about in the industry. So you may recognize what this picture is of. This is a fax machine. It was taken, the picture is taken in a museum in France. And of course, we can still find them in our local healthcare clinics. And this really represents the issue of interoperability, of systems to talk to each other. So our fax machines, they generally do talk to each other. They work well. You can send a fax from one to another, but of course there's limitations. Now, if we compare a fax machine to an electronic medical record or electronic medical record system, an EMR, the fax machine wouldn't connect to any other fax machine. It would take months to figure out how to use it, and it would cost a lot of money. This was really summarized very nicely by Joe Cafazzo, who is at the UHN in digital health. You can also find a lot of these presentations in that technology course that was posted for you before this presentation. So thinking about this in this for physiotherapists, if you've worked in a private clinic or if you've done a placement in a private clinic, you've probably noticed they had their own systems and they used maybe an EMR, they might be using paper charting. But if one clinic is using Jane, which is a popular EMR, and another clinic is using Clinic Master, well, those 2 systems don't talk. And they're privately owned companies, all EMRs are, unless they're built by the hospital themselves. But even within the hospital, some hospitals build their own technology, and then this doesn't connect or talk to any other system. So we're very much in a siloed situation in Canada. And it seems like what I'm going to talk about in a little bit is the Ontario government's digital health first strategy, which we've heard rumors that they are going to be requiring technology companies to have an API, which allows open communication between all systems. And this really would be absolutely game-changing if that does go through. The second reason is complexity. This is particularly more relevant now in the public healthcare system, but I've worked at clinics when I first graduated that used Oscar, which is really built for physicians. It's very complicated. It's difficult to use. It's very clunky. It doesn't have a nice interface. So this is still very much a problem. And in the US, what they've done to help solve this problem, which is really more of a Band-Aid solution, is they've created a whole new job title, which are called scribes. And basically what the scribes do is they follow around doctors and they just listen to what the doctor is saying and they put that into the EMR for them. So of course, this is a very costly solution, and in Canada, we can't possibly do that. So this lesson came from Lydia Lee of KPMG. And she spoke about how Canada has an international reputation as the land of failed pilot projects. And what this means is that there's lots of new technology. I'm sure you've seen and maybe used some new health technology. But what happens is an organization or a hospital will sign up for a pilot project. They put a lot of energy into getting that pilot project going. Even if it went well, it often just fizzles out and goes nowhere in the end. So money and resources go into it, but then there's not really a final product or a proper integration or use of that technology. Hopefully this one shows up. There we go. Okay. This was also echoed in the comments in the chat: risk adverse and security and privacy. I've been told this when I've presented at hospitals, when I've been asked to present at hospitals about what we're doing with Embodia. Often the answer that I was given is this is really interesting, but we've never done it before, so we're scared. And so the answer is no. We can do this for a while, but what we're going to talk about next is the drivers. So what's changing, and with what's occurring in the industry, hospitals and organizations no longer can give this as an answer, that just because it's never been done, we can't do it. Now, of course, on the flip side, we are risk adverse as a profession, and healthcare in general, because we're trained to be evidence-based and we are caring for people's health. So it's really important to make informed decisions. It is important to follow the evidence, but the challenge is that evidence takes a while to emerge and technology moves very, very quickly. Security and privacy, I'll just touch on briefly. We do have regulations that all technology companies have to follow in Canada. PIPEDA is the Canadian regulation, and in Ontario we have PIPA as well. So all Canadian health tech companies have to follow those regulations. Our data has to be stored in Canada, and it needs to be encrypted. Those are kind of like the basics for a health tech company. But most Canadian companies will actually follow the American guidelines because they're actually they're more clear, there's less gray zone, and they're stricter. And most companies want to be used in the US as well as globally. So HIPAA, the American privacy and security policies, are typically what we follow. Any questions so far? Okay, drivers of change. So if we haven't changed as an industry, we've generally been doing the same thing for the past 100 years. Why are we changing now? And again, just type into the chat your thoughts. Why is physiotherapy changing? Or more broadly, why is healthcare changing now? Why are we adopting technology and really looking at it as a potential meaningful part of our profession? Yeah, so optimize care, communication, more efficient, high demand, low resources, yes. Save time. Tech industry is advancing at a greater rate than ever before, yes. So there's external forces that are applying pressure on the healthcare system from tech companies. Better care, cost effective, save money, yeah. Increased population, yes, all correct. So first, we're a changing landscape. Andre Picard is a fantastic health journalist. I just wrote potential future TechDeo health speaker because I'd love to have him present. If you're looking for a great resource or somebody to follow, probably you guys aren't on Twitter, but if you were to join Twitter, now is the time, because there's actually amazing conversations that are happening. Andre Picard is on Twitter and LinkedIn. Those are his two mediums that he uses for social media. I would suggest following him. He's a thought leader in general in the healthcare industry, and he's a journalist for the Globe and Mail. So he just summarizes this challenge that we have created a healthcare system. We live in a healthcare system that was built 100 years ago, and we just have such a different population now. Zaina Kayat, her title is a futurist at SE Health, which used to be St. Eliz. Also a fantastic person to follow on Twitter and LinkedIn. You might see actually a trend here with the thought leaders in healthcare. The primary social media channels that they're on are LinkedIn and Twitter. So Zaina says the future of healthcare is the home, or the hospital. So there's a lot of innovation. There's a lot of research going around how can we create a effective environment in the home so people don't need to be in the hospital. And Zaina's most certainly a leader in this area in Canada, and she's spoken at TechTO Health once. That was April 2018. Funding is on the rise. So this is external funding. This is a snapshot from something called Startup Health. They're based in the US, and this is VC, so venture capital funding, investors putting money into health tech companies. And you can just see this general trend that we're increasing the amount. So if we take 2012, there's $2.3 billion that investors put into health tech companies in the US. And in 2018, that number was $14.6 billion. I know it can be hard to think in the billions of dollars, but the takeaway is that there's a lot of money being invested into health tech companies. Of course, these numbers are smaller in Canada, but the trend is, it looks about the same. So clinical entrepreneurship, this is just a snapshot of some of the companies that have presented at TechTO Health that are led by a clinician. So these are all companies that are led by a doctor, obviously Embody is by a physiotherapist. Therapia is also a physio run company. And they are basically a home care service. So it's like Uberization of physiotherapy, I think is what they call it. People can sign up for this service and order a physio to their home. So private in-home physiotherapy. Maple, we're going to come back to them. They are a telemedicine platform. They just announced yesterday that the Ontario government is now covering virtual sessions, virtual medical appointments on their platform on Maple, just as they would for in person. So visiting a doctor, you can now do it under OHIP using virtual care. This is a massive step forwards, but obviously needed in the times that we're in right now. CloudDX, we're also going to come back to.
Maggie, I can't hear you anymore.
Oh. I'm not, is your mic off? Or like your audio is down, Pat? Obviously, if you can't hear me, that's not helpful.
Hello again.
Hi. Okay. Okay, perfect. The others that I'll just touch on briefly here, figure one is like Instagram for doctors, but they have all kinds of healthcare practitioners that use their platform. The basis of it is that you can join this private secure network. It looks very much like Instagram, except the pictures or videos that you upload are clinical cases. So this could be like if you're on a clinical placement and you receive a report or x-ray, let's say, and you're not really sure what's going on or what to do, you can post on Figure One your question and thousands of practitioners from around the world will respond. So that's one that I think all healthcare practitioners should join. It's incredibly valuable. Seamless MD, they're a digital, they're also led by a doctor. They are a digital platform that improve patient care going from inpatient to outpatient in a hospital. So providing some of those like clinical pathways from medication use to even rehab exercises. So instead of giving somebody their program or their information on a piece of paper, it's all in an app or on an online platform. And care team, also led by a doctor. So there's also a trend here. A lot of our health tech companies are led by physicians. There's very few that are kind of getting a lot of press, I'd say, that are led by a different, some other kind of profession. Care team is working to connect all health tech companies because, again, just like we currently work in silos with our different systems that we use, when we create more technology does not necessarily mean better. It means that there's more tools, but then, you know, is somebody going to use one tool when they're in the hospital, one tool when they're getting private or home care, let's say, and then another tool if they go see another profession in the private clinic. So Care Team is working to connect all of us health tech companies. Okay, patients are consumers. So this is a big one as well. When patients walk into a clinic, or even if you see a patient in a hospital, what people are expecting is different than even 10 years ago because the world around us has changed. Everything else has gone digital. You can order, an Uber, you can book Airbnb. Everything is really like simple and easy to use except healthcare. So you might imagine if you look at back pain, you're going to get a whole range of things from physio for sure, but also all of these other options, Dr. Ho machines, the at-home TENS unit, right? Green juice, naturopath, water therapy, Reiki. That was something new that's I just recently seen coming out is float therapy. Of course, cannabis as it's become legal. And potentially the biggest competitor for physiotherapists, particularly at the moment in the midst of this outbreak, is medical marijuana, or potentially just self-prescribed marijuana, and Netflix, because it immediately gives people relief. We're in a profession that is extremely valuable, as we know, and we're evidence-based, and we have evidence to support us. But we don't always help people feel better right away. And we're in an age of instant gratification. So this is potentially going to be an ongoing big competitor for us. Another factor here is that all the large companies are joining. So Amazon has recently built or is in the process of building a hospital for their employees, and they also have digital services like telemedicine for their employees. Google is getting involved. Apple, of course, you've probably seen the release of their new Apple Watches, which I believe was last year, can take an ECG and it detects falls. And Facebook also getting involved. They've been putting a lot of money, particularly into MRIs and how to use MRIs with artificial intelligence. So some of the trends that are occurring right now in healthcare, there's many, and I just picked a handful that I thought was most timely and also most applicable to physiotherapists. So of course, we have the trend of being found online, let's say. So people are looking up everything. Dr. Google is really a thing, and I'm sure in your clinical placements you spoke to some people who said, particularly in private practice, you know, I have this back pain. I've already looked it up. You know, these resources online told me that I have a slip disc or whatever it might be. So that is absolutely something you're going to encounter when you get out and start working, and even through your clinical placements. Of course, social media. Pat, you had asked me to pause here as well. So we're going to spend a little bit of time discussing social media. There's a lot of value in being able to connect with people from around the world and even have conversations or learn from people that you may not otherwise have had the opportunity to learn from. But of course, social media is kind of like whoever yells the loudest gets the most attention, which is not the best way for it to be. So we just need to be mindful as professionals what we're putting on social media, and you know, who potentially is going to be seeing it. There was somebody who had a question. I don't know if you want to turn on your mic or if you just want to put it into the chat about.
This is me.
Oh, okay, perfect.
Turn on.
Roger was going to share something, an
Great.
experience from her clinical placement.
I don't know if you can see me, but hello.
Okay.
So Dr. Miller asked me to share one of my experiences. Basically, when I was on placement, there was a lot of younger people coming to the clinic, and one of them was, I guess, like a YouTube vlogger, and we were just talking about what she did and her vlogging experience, and she basically asked me to be in her vlog and talk about physiotherapy, and particularly we were talking about posture and like what I had learned in class about posture. But then I didn't know what I was supposed to do with that because I felt like I couldn't represent the profession and like give out accurate health information at the point of my student career. So I didn't really know what to do. I didn't end up doing it, but yeah, I just thought it was interesting. Did you get all that?
Yeah, thanks for sharing. That is a common experience. Let's say lots of physios and chiros and all kinds of professionals experience this. I don't think there's one right answer. No, I'm not from the college, so I don't know what the college would tell you to do. Most certainly, physios do collaborate with people outside of the profession, whether they're a vlogger or Instagram influencer, and post general healthcare information. You can look up all sorts of physios particularly on Instagram and potentially YouTube, actually, that would post that kind of information. That is definitely physiotherapy advice. Now, again, just because they're doing it, I don't know if that necessarily means that it's right. And it is a gray situation. So maybe, Pat, do you want to weigh in on this as well?
Yeah, thank you. And my guess is there's other people who have maybe another similar. I think that when we kind of are trying to figure out if something's right or wrong, I like Kajal's just saying, it didn't feel right and I'm not in the right place in my career. And I think that we recognize that it's great that this blogger has recognized that information about posture is something that other people want to hear about. But I think, for example, Maggie, your resources on Embodia are open to anyone, are they not?
No, I'm not sure what you mean, like our courses or our patient content?
Or do you, yeah, I just wondered where do people get credible information about proper sitting posture or proper posture, or how to readjust themselves when they're on the computer for a long time? And I think we're in a profession where we think about accountability and we think about our responsibility. Oh, well, there are those words, I didn't even see them. So I think Kajal's kind of gut feeling was, I'm not the right person, was right. So I think when you've finished your program, then you'll know if you're well equipped to speak about that. I wouldn't be well equipped to speak about proper posture. I've got the bare minimum basics, but you would know who in our professional community would do that. So even though I was a registered PT, I wouldn't do it. So
yeah, I think that's actually a really good point. Whether you feel like you're equipped to provide a evidence-informed answer and quality information. The flip side of the argument is that if we as physiotherapists don't step up and provide information, whether it's on social media or other mediums, then other professionals are going to do it, which could include personal trainers or yoga therapists. People who are less educated than us will take that opportunity to provide the information. So I think there's also that consideration from a professional branding standpoint, and if you feel comfortable and confident with the information that you're going to provide, and the disclaimer that this is just information, it's not necessarily advice or medical advice, then I'm on the side that I think it's okay to do it, but again, I'm not from the college, so. And in terms of the information on Embodia for our patient information, like the exercises, our exercise videos, our patient education, they have to be prescribed from a physiotherapist to the patient. So they're not open and accessible to anybody.
I wondered if anybody else had experiences while they were in clinical placement that were related to social media.
Yeah, does anybody else want to jump in? You can either turn on your mic or you can put it in the chat. Maybe not. Okay, we can come back to that if anybody wants to share or at any point. We're going to move to the trend of virtual care. So this is most certainly timely. This quote here is from a presentation from Brett Belchetz, who is a physician, and he is the founder of Maple, which is a Canadian telemedicine platform. So the quote I pulled was, "We can improve access to healthcare through virtual care, even though there's a big obstacle that the government won't pay for it." Well, as of yesterday, pulled this from LinkedIn, it is now covered under OHIP. This was pending anyway, so the government was already going to make this move to covering virtual care appointments. It was in the works, but it got fast-tracked. And yesterday, you can now book. So this is also valuable for any of you. If you have family members or if you yourself are feeling symptoms, you can book an appointment through Maple and they will connect you with a doctor from the comfort of your own home. So there's, of course, also virtual care examples in physio. We have definitely different limitations with tele-rehab solution. We're a hands-on profession. There is evidence for therapeutic touch. There is something about being in person with our patients. But in a time like this, when the association, the OPA, and this OPA, and I believe the other provinces have also sent out this communication. But yesterday, the OPA sent out an email saying that it's not mandatory, but they are asking physio clinics to close. So in this case, what are the alternatives? And virtual care is one of them. There's definitely physio platforms. One's called Physio, another one's called Sino. And over the weekend in Embodia, we built a tele-rehab, a very low-cost tele-rehab solution that is PIPEDA, PIPA, and HIPAA compliant into Embodia. So our users are going to start with tele-rehab sessions through Embodia as well. This is an innovation from also a Canadian physician, Sunny Coley is his name, and he started a company called Cloud DX. He started this after he came back from Haiti, where he went to provide medical relief after the hurricane. And what he kind of cobbled this together while he was there with some other physicians, but it's basically a low-cost ECG, so it can provide all kinds of measures on a very low-cost device. Now, over the many years that he's been developing this, it now also measures other simple things like oxygen sat, temperature. There's some urine samples that can also be taken, and these can all be tracked and passed to your doctor from home. So of course, this has a great connection with telemedicine. Now you can have a visit online with your doctor, but they can also have objective measures of how you're doing through a secure and private platform. I touched on this before, so the Ontario Digital First Strategy, this was released at the end of 2019, Mr. Greg Hine from the Ontario Ministry of Health did come and join us on a panel at TechTO Health in November of 2019. It is on YouTube. It was a fantastic panel. So if anybody's interested, I encourage you to listen to it. And I was surprised at how candid Greg was when he was discussing the Ontario government's plan to roll out this digital first strategy, because the strategy and like the documentation behind the strategy was released in 2019, but there weren't a lot of specifics, like what is the specific plan here? One of them that I had touched on previously is this idea of requiring health tech companies to have an open API to help reduce a siloed system so that we can all connect, send information from private clinic to hospital or hospital to home care, even if we're using different systems. Because in Canada, the general thought now is we're not going to create one universal system, right? So that's one option. Everybody in Canada uses one system, and it could be one public healthcare system, and then private would likely be different systems. So a few years ago, that was a conversation. Do we create one universal system that everybody across Canada uses? Or do we have multiple systems? So we allow all these companies to crop up, create their own systems and solutions, or even, again, hospitals sometimes create their own technology, whether it's an EMR or otherwise, and create a way for them to talk. And the way that we're going in Ontario, and it looks like the rest of Canada is going to follow, is we're going to have lots of different companies creating solutions, but there's going to be some sort of regulation around having them be able to share information. I didn't ask this before. I often ask this at the beginning of the class when I do present. Is anybody here interested in building a tech solution or going into health tech or innovation in some way? No, that's fair. It's usually, I find it's usually about 90% of the class says no, and 10% says maybe. Is anybody interested in going into private practice or like starting a clinic business? Yes to business. Okay. Yeah, maybe someday. Yeah, so I'd encourage all of you to, I know you're in first year, so it's overwhelming already with the program, and particularly now with all the changes that have happened. But just keep it maybe at the back of your mind as you're graduating, which will come faster than you might think, and you've gone through the PCE and you can take a deep breath and going into practice. I would encourage you, and the thing that I wish that I had done was diversify my skills earlier, even if it means networking in different industries, but just keeping an open mind to other ways that physiotherapists can get involved outside of the traditional practice. So Jennifer Stinson at Sick Kids, she was involved in creating the app that is called Pain Squad. And Pain Squad is an app that helps kids gamify their experience with persistent pain or cancer treatment. So it helps them track their symptoms, but in a really fun, interactive way. And she spoke about in August 2018, this need for human-centered design. So just because we build something doesn't necessarily mean that it's useful. We really need to have the voice of everybody involved, meaning patient, caregiver, healthcare practitioner, and the people who know how to build technology. This is a hot topic right now, and it most certainly will affect us as physiotherapists. Deep Medicine, if you're interested in reading the book by Dr. Eric Topol, is a fantastic read. He is also on LinkedIn and Twitter. And he says, combining the power of humans and machines, intelligence, both human and artificial, would take medicine to an unprecedented level. We can put the care back into healthcare with assistance from Dr. Algorithm. So AI, being artificial intelligence, has really become a hot topic in the last couple of years again. It's been around since the 60s, but it had a rough start, let's say. It didn't work properly. It still doesn't work that well, but there's a lot of research going into it and a lot of improvements. So artificial intelligence, just a few definitions if this might be new to you, and I'm most certainly not an expert in artificial intelligence, but AI is technology that exploits vast amounts of data to identify patterns and make automated predictions. So this could be something like before a patient comes into a clinic, they fill out a questionnaire on an app, and in that questionnaire, it's asking for symptoms, what was the injury, what happened, what does it feel like, general, kind of like providing a general overview. And then the AI would be able to give some data or information to the therapist, or potentially back to the patient, about what their injury is and what their prognosis is. Embodied AI is just a fancy way of saying robots with AI capabilities. Machine learning, this is really what's moved AI forwards in the last couple of years. So it's improved. It's an improved way of using data, and deep learning is what is being predicted will be kind of the next generation of AI. And this is really removing humans altogether, and machines will learn how to make the predictions. We're going to go into this a little bit more. So right now, the way that AI is built is humans teach it. So mostly in India and China, there's large companies. The biggest one, I believe, is iMerit, which is hired by a lot of the Silicon Valley companies, not just health tech, but for this presentation, we'll talk about health tech. And what these companies do is they have thousands of people who sit at computers and they respond to usually images on the screen. So they might be shown an image of an apple, and then they're asked, is this an apple? Yes or no? And then they're shown another image. The image might be a banana, and they're asked, is this image an apple? And they type yes or no. And that's how the AI learns. So the AI is learning based on humans, which has some moral and ethical considerations. Are there any that you can think of? So if we humans are teaching the AI what is a medical diagnosis, for example, versus what isn't, or what is right or wrong, what are some of the possible implications of this? Human error, yep, absolutely. Human error, and we all come with biases. So this was a piece published in the New York Times recently, where a journalist went and visited one of these new kind of AI companies or centers. And we all as humans come with biases. This is also something important to keep in mind as you go into clinical placements. We all have our own internal and subconscious biases. And when we use these to teach computers, things like a lot of our research, for example, is based on white men. So if we're basing what an AI should learn from research that's all white men, but then we want to speculate that across all the populations, there's going to be inherent biases with this. And this is a big one. The people training the AIs are not trained in this example as a doctor, but if it was a physio AI, the AIs are typically not being trained by professionals. They're just people that are hired to sit at the computer and answer yes or no over and over and over again. But we're teaching them to do the work of a doctor or work for healthcare providers. So we have started to get into this area a little bit. My business partner really does like to create new projects. So we have something called Embodia Labs where we test out new potential features. Embodia is built to be able to support artificial intelligence using user data and incorporating physiotherapy research. And one of the things that we're testing right now is using smartphone cameras. So just using a smartphone camera, having somebody be able to measure their range of motion, for example, and being given 2.02 degrees accuracy on that range of motion measurement, and being able to predict how that person rates for their injury, for their gender, for their age to others in terms of recovery rates and prognosis. Changing models of care. This is a really big one that's also come out recently. These three companies that I've posted on the slide here, these are all press releases. These companies have raised a lot of money. As you can see, Hinge Health just raised $90 million, which was released in February of this year. They are all essentially digital physiotherapists using AI to replace what we do. They are apps. It's like an app where you can log in, input your symptoms. If you have a diagnosis already from a doctor or from somebody else, you can put it in that information. And the app, the AI, will give you a program to follow. So this is essentially AI-based home exercise programs and patient education without the physiotherapist. So it cuts out the physio, and the patient just follows along with their program on a day-to-day basis. The program updates based on their progress and their input of symptoms and other data points that we would consider outcome measures. So these companies have all raised a lot of money. Sword Health is in the UK. Hinge Health and Kaya are in the US. And you might be saying, well, is there any research for this? And how do we know this actually is helpful for people? You also see that there's a trend here. I don't know if Sword doesn't quite say it on the screen there, but these three companies have all started with by tackling the market in persistent pain. So persistent pain management, or chronic pain, is the first area that they have built their AI for. And yes, there has been research done. Not a lot of research, but research that they are citing in their pitch decks and their decks that they would present to investors, which is how they get all that money. And what this research study showed was that there's actually no significant difference. People who used Kaya was the one that was researched in this study, and evidence-based physiotherapy,